Today's our topic is communicable and non-communicable diseases. So, health and disease both are central concepts if we are talking in public health. So, public health में देखते हैं health and disease integral part है, right? And these are also a part of clinical medicine and a part of epidemiology. Disease is deviation from normal functioning of a body. It can be physiological, it can be psychological. Often there are symptoms. There can be symptoms, there cannot be symptoms. So, the human being can be symptomatic or asymptomatic also. And it may result in disability and death also. So, the health and disease can result in disability and even death. So diseases arises from a wide range of causes. There are many causes which cause a disease, and they can be infectious agents, they can be genetic predisposition, there can be environmental exposure, lifestyle behavior, and even the aging process. So if we classify the disease, so broadly there are two types of diseases like communicable and non-communicable disease. Communicable disease which are infectious and they are transmitted from one person to another, either directly or indirectly. While the non communicable diseases are not transmitted through person to person, but they are often originated from basically from the lifestyle factors. So, first of all, we'll talk of communicable diseases. So, they are also known as infectious disease caused by pathogenic microorganisms like bacteria, virus, parasite, fungi, transmitted from one host to another, either directly or indirectly. So, the presence of infectious agent should be there. There should be a defined mode of transmission. Uh, these are potential for outbreaks, epidemics, and often they are preventable also through vaccination, sanitation, and behavioral interventions. So, they pose a significant threat, significant challenge to global health, particularly in middle income countries. Next is non-communicable disease. So non-communicable diseases are chronic conditions. Chronic means they are not acute, means they are in the human being or since a very long time period. They develop over time and then they become chronic, and maybe but these do not spread from one person to another. Basically, these are lifestyle factors, lifestyle diseases, and multifactorial etiology is there, means multifactorial causes are there. Lifelong management is needed for them, and often they are contributors to disability and premature death of an individual. So cardiovascular diseases or cancer, mental health diseases, these are all a type of non-communicable disease. So we are coming directly to communicable disease. So the characteristic features of communicable diseases are like will be in presence of infectious agent. There would be a defined mode of transmission. Mode of transmission means specific transmission pathway would be there where it travels from one host to another. Like airborne droplets like contaminated water or food, insect vectors, direct contact, sexual or blood exposure, there would be a certain mode of transmission. Then outbreaks and epidemics means there can be a sudden increase in cases in a local area. Epidemic when we talk of a country, and pandemic when it is a global epidemic. And often there can be a region also where then epidemic can be there. Then preventability and controllability. Yes, it can be prevented from vaccination, sanitation, vector control, health education, and there is a term called incubation period. Incubation period means time this time between exposure to an infectious agent and the onset of symptoms. So there can be a short incubation period, like in case of influenza, where it is 1 to 4 days. Cholera, it is some hours to 5 days, and there can be a long incubation period also. For example, like hepatitis B, it can be 30 to 180 days even, and rabies also. In rabies, it's in months, like 1 to 3 months. So same like hepatitis B, 30 to 180 days. So incubation period, what and why are we studying incubation period? So understanding incubation period helps us to see that how much quarantine is required, means isolation of a person is required. What is the estimated exposure window? Exposure window means ki how infectious a person can be, and is there a urgent requirement of isolating him or not. Then designing a surveillance protocol, then predicting an outbreak dynamics. So incubation period helps us to study all these things. Now we come to classification. So there are many classifications of communicable disease. Means they can be classified on the basis of etiology. Etiology means on the basis of the pathogen, basic nature of pathogen, like it's bacteria, virus, parasite, or fungi. Or it can be classified on the basis of transmission, mode of transmission. So it can be airborne, waterborne, foodborne, vectorborne, contact basis, sexual basis, or bloodborne, or any zoonotic pathways. Third is on the basis of clinical syndrome and site based classification. Like what is the anatomical site of infection? Right? So, what is the clinical presentation? Clinical presentation, what are the symptoms? What organ systems are affected? Like, are there respiratory infections affecting lungs? Are there intestinal infections causing infection in your stomach and intestine? Or they are skin and surface infections, or they are STIs or zoonotic disease. So there are three types of classifications under which these can be classified. All three classifications I have shown below. So if first we talk of causative agent, what are the causative agents? Like bacteria, virus, parasites, fungi, zoonotic like zoonosis, animals, STIs, right? So these are 6 types if we classify according to the causative agent. Okay, so cause bacterial diseases are tuberculosis, typhoid, cholera. Viral one is measles, HIV, dengue. Parasitics are like malaria, amoebiasis. Fungal, it's ringworm, candidiasis. On the basis of animals, transmission from animals, it can be rabies, like it is caused from a dog bite, and STIs. Okay, so these are some causative agents written, all the diseases and their causative agents are written here. Okay, so these are certain causative agents you have to learn for the exams also, like the main ones. Okay. Then we come to classification by mode of transmission. So mode of transmission, we told you like they can be airborne, it can be waterborne. Like this is the table that is shown. Like airborne transmission, uh, tuberculosis, influenza, measles, chickenpox. Waterborne, where contaminated water is taken by the human being, cholera, typhoid, hepatitis. Foodborne, like food poisoning. Vector-borne, malaria, dengue, chikungunya, scrub typhus, filariasis. Soil-borne, the common one is tetanus. Contact is leprosy, scabies, ringworm, trachoma. Sexually or blood transmission is HIV, syphilis, gonorrhea, hepatitis B and C. Zoonotic is rabies, plague, and anthrax. Then we come to classification by clinical syndrome and site of infection. Like anatomical site of infection, it can be respiratory, it can be intestinal, vector-borne, contact, skin, reproductive system is involved, or any type of animals are involved. So these are like respiratory example is tuberculosis, influenza, measles. Intestinal is diarrhea, cholera, vector-borne malaria, dengue. Contact one is leprosy, tetanus, STIs are HIV, syphilis, gonorrhea, and zoonotic is rabies and plague. So, why are we studying these communicable diseases? So, we are studying communicable diseases because the vulnerable population is at risk. There is a potential for outbreak if this infectious disease, or if these communicable diseases spread and take a like it spreads like an outbreak, right? So we have to study them. Like there can be the seasonal patterns for them. Like the season, like rainy season, it is very prone to malaria and dengue. So we have to see that what are the seasonal patterns, what are the incubation periods, and how can we coordinate with the response mechanism, and just have a control over the outbreak, right? So this is the importance of studying communicable diseases if we talk of public health importance. Yeah. So, what is the burden of disease? Why are we studying? Because we are also studying because the communicable diseases are imposing a significant burden on the public health system. India's health system is also very much affected by it. So, if we talk of statistics, there are over 6 lakh new cases of TB annually reporting. HIV prevalence is approx 0.2% among adults between 15 to 49. Then diarrhea, respiratory illness is also a leading cause of morbidity and mortality among children under 5. Means under 5 children under the age of 5, the particular disease, that is diarrhea, is posing threat to their lives. And next is the coming up one is COVID-19. Though it is declining, but still it has posed a very large impact on the lives of people. So if we talk of surveillance and reporting, so IDSP program is there, integrated disease surveillance program is there, reporting over 700 districts are there. Weekly alerts for diseases like dengue, chikungunya is given, reported. Timeliness is often one of the challenge that is um, being for a long time in the remote and underserved areas. Next is the vaccination programs. Vaccination programs, though it holds very important place in Indian health programs, but still many infants, many pregnant women are not protected, right? Though we are saying yes, 27 million infants, 30 million pregnant women annually are protected against 12 million, 12 vaccine preventable diseases, but still the epidemic, the statistics which are coming up for the diseases is still an epidemic one, right? So current coverage state, if we say ki yes, vaccination drive, how much it is? So like DPT coverage is 85%. Measles, rubella, they are saying 90% in most states. Polio is, they are saying it's polio free. India is polio free since 2014, but still what uh, we as public health professionals see on ground, that still polio cases are coming up. So we can't say India as polio free, though they have declared it, but no. There is HPV vaccination, cervical cancer prevention is also there in some states, but still vaccine hesitancy is there. Dropout rates are there, cold chain gaps are there, and still it's a challenge in remote areas. Then we come to global health priorities. So after polio, TB elimination is one of the most on priority program. So where they aim to eliminate TB by 2025, and we are in 25, and just matlab, 25 is all about like closing, but still we have TB cases. After 25 is over, In 2026, when there will be a survey, then we'll come to know whether we have achieved this target or not. Then is National AIDS Control Program. So it is focusing on prevention and testing. Vector-borne disease control program, malaria, dengue, filariasis, Japanese encephalitis, scrub typhus. Like first of all, uh, previously, like malaria was a threat. Everybody was just suffering from malaria. Then malaria just came down, but dengue cases rised, right? And nowadays, since 2 3 years, you can say, or some 1 or 2 years, you can say, now dengue cases are also going down, and scrub typhus is coming up. Okay, so these are vector-borne diseases. One or the other disease is coming up with a very strong threat to the human beings. Okay, so India contributes to WHO's global health security agenda, and one of the thing that is more of a concern is antimicrobial resistance. What is antimicrobial resistance? Like in India, everyone is a doctor of their own, right? We know that this is the medicine for this disease, but we don't know the dose. We don't know the right dose to be taken. What is the severity of disease? What is the severity of infection, and in what dosage we want the disease? We want the medicine. So what's happening? People take medicine like we all know that antibiotics should be taken as a 3 day course or a 5 days course or a 7 days course. But what's happening is the people take the medicine, they take 2 days, get okay, but after the third day they don't take the medicine. Then again the infection reoccur. Then again they take the medicine. Again there means again to after 2 days it is okay, then again they are leaving it, then again recurrence is there. So when repeatedly it happens, the microbe inside the human body also become very strong, and they become resistant to that particular disease, sorry, that particular medicine. So that is antimicrobial resistance. Now whenever they'll take that medicine, they'll not be okay. Okay, so that medicine will not work on them. So that is the antimicrobial resistance, and it is becoming a threat to human being, and a very big challenge in front of all physicians, that how to control any disease now, right? So these are all aligned with sustainable development goals, like targeted 2030, and which particular the SDG goal third targets the reduction of communicable disease burden by 2030, right? So this was all about your communicable diseases. Now we come to non-communicable diseases. So non-communicable diseases are not caused by infectious agents first. They do not spread from one person to another, second, and thirdly they are influenced by the human being himself. Okay, so human being by himself means the genetic makeup, the behavioral pattern, the environment in which the human being lives in, and other metabolic factors, they all affect the uh, health of a human being, and the disease which are caused by these alterations are known as non-communicable. Okay, so key characteristics features, we said non-infectious etiology means not caused by microbes. Genetic mutation, metabolic imbalance, environmental exposure, and behavioral risk factors are there. Chronic progression means they are slow but progressive. So they need lifelong monitoring, lifelong therapeutic management. Multifactorial risk profile is always there when we talk of NCDs. Multifactorial risk factor means the disease is a interplay of multiple factors, where we can say that age, heredity, sometimes diet, physical inactivity, their sedentary lifestyle, their usage of substance abuse like tobacco, alcohol, these are all often play role together to pose a threat to the health of the human being. Then since it's non-contagious, but still it can be it is posing threat, means multiple like clustering is there. They have, we have a shared genetics, though it is not means spreading from one person to another, but if it's going from generation to generation, so still there is familial clustering in it, and we cannot like break the chain. Okay, if it's genetic, so it's genetic. Then these NCDs have a high burden of disability and mortality. Mortality is the death rate. Okay, so NCDs are responsible for majority of premature deaths and years lived with disabilities. So now if we classify non-communicable diseases, so we have here number one as cardiovascular diseases. So cardiovascular diseases are often linked to hypertension, atherosclerosis, and rheumatic damage. So for the non-clinical background people, hypertension is high BP, high blood pressure. Atherosclerosis is the like plague on your inside your veins. Okay, and rheumatic damage is uh, like arterial damage. So examples of these are hypertension, that is high BP, coronary artery disease. Coronary artery is the artery which supplies oxygenated blood to the heart. So if there is any blockage in that coronary artery, then it poses threat to heart problems. Stroke. Stroke we have ischemic and hemorrhagic. Ischemia means low oxygen demand. Hemorrhagic means where the blood vessels, that is the uh, capillaries burst out, and there is stroke, means there is bursting of blood vessels. Then is rheumatic heart disease, congestive heart failure. Okay, so risk factors for these are like high blood pressure, smoking, sedentary lifestyle, high cholesterol, and diabetes. Next, we talk of metabolic disorders. Metabolic disorders means they are dysfunction uh, in metabolic processes, and often they involve glucose, lipids, body weight regulation, and all. So the diseases are diabetes, obesity, metabolic syndrome, and hyperlipidemia. So hyperlipidemia is the more scientific term for obesity, you can say. Hyper means more, lipid means fat, and emia is the condition. So more fatty conditions inside your body, that is obesity. Okay, so risk factors are poor diet, physical inactivity, genetic predisposition, and insulin resistance. Next are the respiratory disorders, where we talk of asthma, COPD, bronchiectasis, and pulmonary fibrosis. Risk factors are again tobacco, smoke, air pollution, occupational exposure, and any genetic susceptibility. The next one are mental health disorders, where the conditions are affecting the mood of a person, the behavior of a person, or emotional regulation of a person. The examples: depression, schizophrenia, bipolar disorder, anxiety disorder, suicidal, and self harm can also be there. Risk factors, genetics can be there, trauma, stress, substance abuse, and social isolation. The fifth one is neurodegenerative disorders. So this is progressive deterioration of neurons and the nervous system functioning. So examples are Alzheimer disease, Parkinson's, dementia, Huntington disease. And risk factors are again the aging. The main thing is aging, which causes neurodegenerative disorders. Then comes your cancer. It is malignant growth of cells inside the human body. Uncontrolled cell division is there. Example: breast cancer, lung cancer, cervical, oral, colorectal, and other organ cancers are also there. Risk factors: tobacco, alcohol use, viral infections, genetic mutations, environmental carcinogens entering into the human body. These all causes the cancer. Next, we come to musculoskeletal disorders like the conditions affecting bone, joints, muscles, and other connective tissue. Examples: osteoarthritis, rheumatoid arthritis, osteoporosis, and ankylosis, spondylitis. These are all affecting your bones and musculoskeletal system. Then comes your genetic disorders. These are thalassemia, sickle cell anemia, Down syndrome, autism, hemophilia, cystic fibrosis. These are all genetic disorders. Often risk factors are the family history. Then again, what is the importance of studying NCD under public health? So conditions like these, like CVDs, genetic disorders, these are accounting two-third of all mortality rate uh, in the country, and it is a growing share of healthcare expenditure. Means first, in certain there was a certain period of time when the infectious disease was a threat to human being, but now more severe cases of these NCDs are coming, and often these are not um, means regulated by any third individual. The human being himself has to do certain things and do certain preventive measures for themselves, so that this NCD prevalence can be broken, right? Some national programs are being launched, like a program for prevention control of cancer, prevention and control of diabetes, like cardiovascular stroke. But often these are, you can say, these are often n- not in use if the community support is not there, if the outreach programs are not being undertaken, and the people themselves, if they do not want to be okay, then any third person or any national program will not work for them. Yes, burden of disease. If we talk of burden of disease, these are now the leading cause of death in India. 55% of disability adjusted life years has been calculated. 55% means 55% of people are living with disability caused due to NCDs, right? So these are different epidemiological statistics shown here. Then surveillance and monitoring. So government is working day and night for the surveillance and monitoring of all these programs. We are aligned with the WHO targets. We are launching new schemes for them, like Ayushman Bharat has been launched. National Mental Health Program has been launched recently. The gaps, like government is trying to cover up the gap in rural coverage, and the most important thing is preventive and health promotion interventions to be given to India. So you can see that we have some lifestyle campaigns, thus like slogans being for launched for the people, right? Eat Right India, Fit India movement, Tobacco Free India. Then we are celebrating many days, like yoga days being celebrated, and certain particular days related to certain diseases is being celebrated. Like nursing people also celebrate National Breastfeeding Week. So these types of policies, these types of programs are being launched and are being celebrated in the country, so that people may come out of these NCD prevalence. Means the global burden can also be lightened somehow. And yes, in the country, we are still working on them. So this is all about your communicable and non-communicable diseases. The next thing is ki what are the public health implications, like what government is doing on it. So one thing is surveillance and monitoring. Next is prevention and health promotion strategies. Then we are strengthening the health system. We are working on the workforce training. We are working on capacity building, infrastructure development. Then policies and programs are integrated. They certain guidelines are being launched day and night, working on them. Even the school-based health education programs are there. The NGOs are working day and night for the health of people. The vulnerable population like low income, crowded and immunocompromised groups are being identified, and then they are given all possible help that the government can give. Then community engagement is required, like NGOs, ASHAs and ANMs all are being invited and being requested to work together towards the health of people and towards the health of community. So yes, this is all about your communicable and non-communicable diseases.